For 2 decades, federal law has barred Medicare from paying for drugs prescribed solely for obesity, and that all changes starting today. Here to explain this pivotal change in healthcare access is CBS News medical correspondent Dr. Céline Gounder, who is also editor-at-large for public health at KFF Health News. So, Dr. Gounder, what is the change happening this week?
So starting today, Medicare is launching something called the GLP-1 bridge. So this could affect about 4 million seniors that could newly qualify for GLP-1 drugs like Wegovy or Zepbound. That would be for around $50 a month if they have Medicare. And it's the first time Medicare is helping to pay for drugs just for obesity, not for obesity plus diabetes or plus heart disease.
And I mean, this seems like good news because Medicare then is not going to be paying for the complications of people who might have obesity. What's net? What do you think of this news, and how long will this coverage last?
Well, this is the catch. So this is an experiment, a pilot program, and in fact, in the spring, the insurance companies that cover the drugs under Medicare said that they did not want to sign on a permanent such program. That's why we're seeing this bridge experiment program. And that's because they would be the ones stuck with the bill. And they said it was too expensive. We actually don't have the data that this is going to save big money in the long run. And so what we could see is seniors who start on this experiment and in 18 months lose that coverage overnight. And what we have seen is studies show that most people regain about 2/3 of the weight that they lost on the GLP-1 drugs when they stop taking the drugs.
So you mentioned that there's a catch. Is that what the catch is?
Yeah, that is the catch, as well as that $50 a month that you would now be paying under Medicare. That does not count towards your deductible, and it doesn't count towards your yearly out-of-pocket cap. So for people who are on a really tight budget, that could still be a lot of money for them.
So what do you recommend for seniors? And then just overall, like, a lot of people are on these drugs, but like you mentioned, when you get off of them, you still regain 2/3, if that was the number that you said, of the weight back. Is there an off-ramp to these drugs once you're on them?
Well, okay, so first of all, if you're a Medicare beneficiary, you should first talk to your doctor about whether you have diabetes, heart disease, high blood pressure, and so on, which are a slightly different category in terms of being eligible for these medications. But then in addition, in terms of an off-ramp, a lot of people take these medications but don't make the other changes, which include, exercise and changing your diet. And actually, a lot of the people who have a hard time with these medications are not having enough fiber and water in their diet, so they get really constipated, have horrible abdominal pain.
I was going to ask you about that, Céline, because I have a friend who's pretty big, and he tried to go on this, and he came off of it, and he said, it didn't agree with me. And I kind of wondered, I don't want to press people on their medical history, but I just wondered to myself, because it seems to work for most people. He was saying that he had, and the adverse effects were more like, it made me nauseous, or... And I just thought maybe there's a hump around.
I think, some people start the medication at too high of a dose or ramp it up too quickly, so it could be that. But the #1 nutrient deficiency in Americans' diets is fiber.
Yes.
It's not protein, it's not vitamins.
Preach.
It is fiber.
Yeah.
And so if you're starting these medications, you've got to make that change and get a lot more fruits and vegetables and other sources of fiber into your diet. Otherwise, big picture, this isn't really helping
my
you.
wife tells me all the time, I like fiber, but I don't like going to the loo. So it's
Going to the loo is a necessary part of life.
If I could go for a couple of days, I feel better than going every day. But okay, I know it's important. I'll try. Eat more beans. Dr. Céline Gounder.
I am on a bean crusade for fiber, but you get it from fruits and vegetables too.
Yeah.
Crunchy stuff, right?
Yeah. But beans are also really good for you.
That's why I've been making my chili.
All right,
Dr. Gounder, we're getting the wrap.
Thank you.